Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Good afternoon. I am Dr. Surendra Prasad, and welcome to another episode of Health for Life. Health for Life is a program designed to inform the public about common medical issues. Today, we will be discussing vaccinations. My guest physician today is Dr. Karen Butters. Dr. Butters is a well-known general practitioner who has been in private practice for over 5 years and currently has an extensive pediatric practice. Now, the next question is about the effectiveness of vaccinations. So, does every child who gets the vaccine, are they protected from that disease?
Yes, the child that gets the vaccine is protected, but the unvaccinated persons are not protected. And even though one might be vaccinated, if there's an outbreak, the person may display a mild form of the disease.
Right. So vaccination is going to protect the person who's got that vaccination. Even in an outbreak, they may get the disease, but it would be certainly milder.
Yeah.
And that is the great advantage.
But
the person who has not been vaccinated, they will get the disease in an outbreak, or they're at risk. Okay. Now let's go back again. What about natural immunity? You've talked about the ones that we get from our parents, or from the mother, that last for a couple of months. Are there others that may last a little longer?
Well, the term natural immunity actually is a defense mechanism that is inherited from the parents to their offspring. Okay. And it really doesn't require any prior sensitization to that antigen.
Okay. Now, parents, and you read, there's always concerns about vaccinations, and one of the questions, and I'm sure they've asked you, should I delay, should I wait to vaccinate my child?
No, I would not advise for you to delay. You're putting that baby at risk. There's no evidence that spacing or delaying the vaccines decreases the risk of an adverse reaction, if that is what you're thinking about. The other thing is that you have increased visits to the doctor, you have increased stress on the baby, and the fear of medical procedures that child might go through because of the increased number of visits to the practitioner. All of that I would advise you not to space or delay the vaccines.
Now, can you explain to our parents what is a vaccination record and why is it so important to maintain and keep that vaccination record?
The record is actually a document that both the health facility and the parents or the caregivers keep of the vaccines that are administered and those that are due. It's usually in the form of a booklet. Some doctors will have like small cards, but each vaccine is written into it, the date, the batch number, the signature.
Now, different countries obviously have different diseases and there are different vaccination recommendations. What are the requirements in Guyana as it relates to the vaccinations?
You are required to have the BCG at birth. The polio at 2, 4, and 6 months, a booster at 18 months, and one at 3 years, 9 months. The pentavalent, which is the DPT, the diphtheria, tetanus, pertussis, the Haemophilus influenza, and the hepatitis B. You're required to have that at 2, 4, and 6 months. And you're required to have the rotavirus at 2, 4, and 6 months. And now, the requirement for the pneumococcal virus, the pneumococcus, is 2 and 4 months. It used to be 2, 4, and 6.
Okay. Now, I guess we've got this formal vaccination requirement and the vaccination record. Those are very important documents when you're going to take your child to school. Mm-hmm. So what is the requirement for school?
Well, it all depends on what time you're taking your child to school. For the play school, I guess play school is maybe from just about 18 months or above. So you're required to have the BCG you're required to have 4 doses of the polio. That is the 2, 4, and 6, and the 18-month booster, first booster. You're required to have the DPT and the Hib and hepatitis, 3 doses of that. And then you will have 1 booster dose of the DPT at 18 months. We are now giving the MMR vaccine at 1 year and 18 months, the yellow fever at 1 year. So those would be the recommendations for the play school. For the nursery school, the only other vaccine that should be added would be another booster of the polio and another booster of the DPT.
And would you say it is standard in both the public school system and the private school system for these schools to require documentation that the children have gotten these vaccinations?
Yes, it is a national policy.
Right. And I think it's extremely important that parents recognize that the whole purpose of vaccination is to protect countrywide and all of the children. And so that is important that you have the vaccination record, it's updated, and you present it to the school. Now, there always seems to be controversies. It pops up, we discuss it, it comes up again. What are the controversies surrounding vaccinations?
Controversies include that vaccines, some people say that vaccines are harmful because of the additives or adjuvants that are in it. For example, mercury. Some vaccines will have, they're made with mercury and aluminum and formaldehyde. And studies have been done that say that these substances are harmful, but actually they're not. The amount of the mercury is actually ethyl mercury, and not the methyl mercury that causes damage to the nervous system. The thimerosal is out of vaccines now as a precaution. The aluminum, actually, the children ingest more aluminum from the breast milk and formula than what they get from the vaccines. So it's actually very, very small. So these are things that parents would say, I'm not giving the vaccines because they've read about that. The other thing is autism and MMR. There are no studies to say that MMR causes autism. Years ago, a study came out, but it's not true. Many studies have gone since, and it is not true that MMR causes autism.
Yeah, that is always a recurring concern, as you hear persons trying to link autism with vaccination. And the truth is the scientific community has spoken, and there's no evidence to support that. Mm-hmm. And I think, yes, as you talked about the metals and the other compounds, I mean, in the fish and the other things we're consuming regularly, there possibly much higher doses than you would find in the vaccinations. Dr. Butters, could you at this stage summarize for our viewers and listeners, what are some of the key things you would like them to remember about vaccinations and vaccinations in Guyana?
All right. Vaccinations are important. They're important because they actually protect your baby from many, many diseases. They protect you as a contact person. They protect the environment around them. And by extension, they protect generations. And each child, even though we might be giving them an injection that may be painful, it is many times more painful for the parents watching that injection than for the babies. Yes, they bawl and they cry, but because of the benefits of the vaccine, that it protects you against these diseases, I think that every parent should ensure that their child or their children are vaccinated and at the proper time. Do not delay the vaccines. Make it a priority in your child's life that you will get them vaccinated. Each health center now is giving the vaccines. You have private doctors giving vaccines, so there should be no excuse why a child should not be vaccinated.
One of the things we talked about was the pain, the fevers, etc., that could be associated with vaccination. What advice you give the parents in terms of preparing their child for vaccination?
Two things. depending on the age of the child.
Yes.
The bigger children, you could prepare them. There's the cartoon, trying to remember the name of the cartoon. But there's some cartoons that say, let's go to the doctor, what to expect of the doctor.
Okay.
And vaccinations is one of them.
All right.
They would show you the stethoscope, they would show you the needles, and it is just a little mosquito bite. And so you prepare them, and you can even have practice sessions at home with the bigger children.
Okay.
We're speaking about, let's say, 2 years, 3 years, 3, 9 months,
Correct.
those children. So you could prepare them emotionally for vaccinations. Also, for the babies, you can prepare those babies by giving them maybe some medications before they come for the vaccines.
Okay.
You know that they are scheduled to have 2 pricks, so you basically could give them some Panadol.
Okay, so you can give them this is the medications: Panadol, paracetamol,
Yeah.
acetaminophen, to help with that pain and fever symptoms.
Yeah, some parents would give them before they arrive at the office, and you have to take into consideration the waiting time too.
Okay.
And sometimes I give the medication just before I give the vaccines, or maybe just after.
What's the ideal time before you would want it to be given?
I give the Panadol about half an hour before.
So 30
Yeah,
minutes
30
before
minutes
would be the
before
best time.
the vaccine.
Now, for the child who is refusing to take medications, and so when the child has got the vaccination and is going home, and mom says to you, you know, this child is going to spit out all the medications. What techniques do you have to help mom get that medication in, or what other options they may have?
Okay, I usually am quite amused when I hear them saying that the child doesn't take any oral meds. So what I ask them to do, go get the medication, or I have Panadol in my office. I would say, let me show you a technique.
Okay.
And I would give the child or the baby the Panadol. I usually like to use the syringe, and
Okay.
to make sure that that syringe does not come out of the mouth. So
Okay.
they scream and they gag, but that syringe stays in the mouth until all the Panadol is given. And I actually show them, you put it to the side of the mouth and you squirt it a little bit at a time.
Okay.
And you give them. So I usually do the first. I usually give them first, and I show the parents and tell them to go try it. A lot of time it works. Sometimes it really doesn't work. And the other option,
Yeah.
the other option is that you can use suppository.
Okay.
There are Panadol suppositories that you could use for the children. Very, very effective. That could also be used.
And I know both in orthopedics and in other parts of healthcare, whether we should use a warm compress or whether we should use a cold compress or whether we should use a hot compress, there always seems to be this challenge and confusion. So you've given baby the vaccine. What's your advice to the parent? What kind of compress they should put?
All right. For the little babies, the vaccines go on the anterolateral aspect of the thigh.
Okay.
You will see maybe a local reaction for redness. Mummies are usually afraid to hold the babies on the, around the thigh. But you can use a cold compress on that particular leg. I usually tell them to just get some cold water, put in a rag, and you could apply that on the vaccination site as soon as they get home.
I think it's important to mention to them you don't want them to take an ice cube and put it directly.
No.
So say that to them so that
Not an ice cube. Don't put ice cubes on the children's
right,
legs.
because you will hurt the child. Now, you talked about these vaccinations which are given in the arm or the thigh, and obviously because of the pain, the child doesn't want to move that arm or that leg. What do you say to the parents regarding that?
No, there really are some extreme cases where just after vaccination is given, the child's arms are just to the side. Really, they don't move it at all. In those cases, I usually tell the parents, make sure to give them some Panadol, some antipyretic and analgesic, and also put the compress on the arm or the thigh, and allow them a couple of hours, and then you make sure that they try to move the arm. Okay. I've had a few cases where the children refuse to lift their arms to dress themselves. They refuse to feed themselves. And it's really worrying for the parents. You know, they call back and said, "Docs, I think something is wrong with the baby's arm." But in a couple of days, they're usually, after being pampered for some time, they're usually back to normal.